Alrighty, this is a discussion for patients who have had an abdominoplasty and or a mommy makeover, meaning you've had a tummy tuck with a breast surgery combined and maybe some liposuction as well. This is your video for post-op day 1 to week 1, what to expect in your first post-operative visit, and what to expect when you're home, how to kind of handle all of these things you're going to have to deal with. So here's the main things you're going to have to deal with. With the tummy tuck, you're going to have squeezy boots, or SCDs, sequential compression devices. Those are going to be devices that stay on your legs all the time and except for when you're walking. And I want you to keep those on, working all the time throughout the night when you're sleeping. If you wear them, I promise they'll be comfortable, they'll help you. They sometimes even feel like they're massaging your legs and make you feel better and help you sleep better. So please wear them. I think they'll make a big difference in your recovery. They decrease our risk for blood clots, and they actually feel pretty good, kind of like a massage. So try and make sure you're wearing those because that's for your safety. Additionally, you're going to have drains to deal with if you've had that tummy tuck. And those drains can be a little bit of a hassle. And one of the biggest hassles or biggest unknowns are what amount of drainage is the right amount? What's not enough? What's too much? And am I going to have any other drainage anywhere else? This is important. When we've done liposuction, you're going to have some drainage come out of those liposuction areas. And so people will say things like, it looks like I'm bleeding down in my groin area, or it looks like I'm bleeding from my back. That drainage is normal coming out of there. Don't panic. It's okay if you need to call us. It's okay if you have questions. We're here to take your calls always. But that drainage is normal, and the volume of drainage is likely going to be unexpected by you. It may be as much as 1 liter of fluid will come out of those holes. Even though those holes are closed with stitches, it still leaks out, and it seems like a lot of drainage. So if you've had a mommy makeover or a tummy tuck, when you go home, what your person taking care of you should do on the bed that you're going to be on is they should put a plastic down on the bed, and then they should put towels over the top of that to absorb that, to keep your mattress and sheets from getting ruined by that drainage that comes out. That drainage is liposuction fluid. We put that fluid in during your surgery to help your surgery have less bleeding during the surgical procedure. And that fluid's very important. Everybody uses it and everybody drains. Additionally, you're going to have drains in place. And those drains are going to drain a lot of that liposuction fluid in the beginning. So the first couple times you empty those drains, it's going to seem like a lot of fluid. What is normal is it should be trending downward as time goes on. So the first night you may empty those drains 4 times. But as the night progresses, the drainage should continue to get less and less. Additionally, it should get slightly less red as time goes. So at first, a little bit of blood goes a long ways, and a little bit of blood will be in those drains, and it's going to make the drains look red. But the next time you drain them, it should look less red. The color of sort of red Kool-Aid and the consistency of red Kool-Aid is normal as the night progresses. If it looks more like dark red paint, so it's got a thicker consistency to it, and it doesn't have any clarity to it at all. It doesn't look watery, it looks thick like paint. That's something we need a phone call for so we can assess that and address that. And if you have discomfort about that or have worry about that, call us. We want to answer those questions so we make sure you're safe and everything's okay. Other things, compression garments. When you have a tummy tuck, when you've had a breast lift or a breast augmentation, you're going to have a bra on. When you've had a tummy tuck, you're going to have a compression garment around your tummy. And that compression garment is important in your health and your post-op recovery. It's important that compression garment remain tight and snug. You can adjust it if you need to. So if it begins to get wrinkled up or folded up, we want you to try and adjust it to make it smooth, but make sure it gets put back on just as snugly as it was before. And you as a patient are going to be the one that has to help your caregiver do that right so they can get that snug enough for you. We want that to cover all the areas we operated, so it compresses those areas, protects our muscular repair, and gets rid of that swelling for you and really protects our surgical procedure. Additionally, the breast, we want you to keep the bra on. On occasion, you may be sent home with a wrap on top of the bra, like an ACE wrap. That would be in the case of just a mastopexy on its own, or just a breast lift on its own. When that's done, but without an implant, we typically will wrap your breast with an ACE wrap as well. That's important in maintaining that compression. And we're going to ask you to do different things as time progresses, as the weeks go by, but in the beginning, it's important that those wraps stay good and in place. After that first post-op night, once you're through that, everything will seem a whole lot easier because you got through that first night. And the next day, we're going to want to make sure you're really up, walking outside, going for walks far as you can each time. The more you push yourself, the better you're going to do. And it's important for your care that you participate in your care and you push yourself, and the person taking care of you pushes you, so that you have the best outcome and least amount of potential complications. Additionally, on that post-op day, you can, if you wish, shower. So whether you've had a tummy tuck or a mommy makeover, it's okay to take everything off if you feel up to it and shower that first day. Sometimes that makes people feel a whole lot better. If you do, just pat everything dry. Your incisions may bleed a little bit. Replace gauze over them, and then put the compression garment and the bra and everything back in place just as snugly and just the way we had it. Usually you're going to come see us within the first few post-operative days, depending on what day your surgery is. So when you come back to see us, we're going to take these things off. We're going to look at everything. We're going to look at your drains. We're going to further instruct you on how to take care of those drains, how to strip those drains, because you'll probably have them for another couple days. And so we're going to show you how to do that so you can go home and do that as well. We're going to advise you if we see that the compression garment doesn't look like it's on right. We're going to give you advice regarding that. We have you come back to see us early in this post-operative period because we want to make sure you're walking. Now, I've told you to walk. I've told you to walk that first post-operative night. I've told you to walk outside the next day. You coming back to see us sort of is our way of making sure you're walking. If we see something unusual, we're going to tell you. As we look at everything, we're going to tell you if there's anything unusual or something doesn't look right. We're going to examine your incisions, examine your belly button, examine your breast incisions, make sure your implants are in the right spot, make sure everything is just the way we want it. We're going to wrap you back up. Our staff all does that, and they're awesome. They've been doing that for years, and Stacy will be there to help take care of you, and so will our surgical staff and surgical team that helps us with all of our post-operative patients. They're going to be there to do this as well. We're going to make sure you're following all of our instructions and that you don't have any questions. Oftentimes, you caregivers who are coming in with this person, you're obviously going to bring them in afterwards, bring our patient in for us. You're going to have a lot of questions, and that is time for you as well to ask your questions. Make sure you understand everything. We want to make sure you're completely informed so that you can help us take the best care of our patient and your patient that we possibly can. For abdominoplasties and mommy makeovers, one thing I neglected to mention that I think is important, make sure you're taking the medications as we've prescribed them for you. Try and get off those pain medicines as soon as you can. It'll be tough the first couple of days, but usually by day 3 or 4, people are really weaning down off those well. And so try and do that the best you can. It's going to help with your recovery. The more alert you are, the less pain medicine you have, the more you're up walking and moving, the better you're going to do. Pain medicine creates another problem that I think is important to discuss really quickly, and that is constipation. Pain medicine dries out everything in our intestines, slows our intestinal motility, and can cause significant constipation. If you're taking too much pain medicine, that can actually become then the most painful thing that you're experiencing. It can be more painful than your surgical procedure. So, if you're taking a lot of pain medicine, beware that's probably going to occur. And for most all of you, I would recommend taking a stool softener right from the first part, right after your surgical procedure. And if you start to feel like you're getting constipated at all, go get something like milk of magnesia or Fleet's phosphosoda or mag citrate or some other laxative to help you and increase your stool softener pills as well. So discuss that with us when you first come in to see us for your first post-operative visit. We'll advise you further on that, but my recommendation is start taking something sooner than later before it becomes a problem. Alrighty.